So our lovely patient who's 54 years old is about 7 days out from her belt lipectomy, which is a 360-degree surgery, removing skin and extra adipose. She also had a hernia repaired at the same time. And she comes in today, drove herself to the office, and she's very graciously agreed to share some of her thoughts and feelings about her entire experience so far.
I did a lot of research online and came across Dr. Claytor's name and recommendations by many resources. Went on one consult, which was here, made an easy decision because he made me feel at ease, answered all my questions, and he has a rockstar staff.
We do have a great staff, that's for sure. Share with everyone, what was your journey leading up to considering surgery?
For probably about 10 years or more. I was really thinking about it, mulling it over. Do I want to do this, considering my age? But really, I just wanted to feel better about myself and more confidence. I'm a professional, and it means, showing up on stage and things like that, and just wanted to have that more confidence level.
And here we are at a week. I tell everybody that you're going to hate me for 3 days. Was I pretty close?
Pretty close, yeah.
And I am impressed that you drove yourself here today. I will say to everybody listening that you were probably 2 standard deviations above the mean, and that most of our patients are driven in at 1 week. But I would say, and Julie could second this, that almost everyone drives themselves at week 2. And sometimes the spouse will come with the patient, but pretty much everybody is driving by really about 10 days. So if you hated me for the first 3 days, and I own that, and I'm comfortable with it, and I want you to direct that towards me because I can absorb it. But about when did you move past that to the phase where you felt comfortable enough to be able to drive yourself?
Probably about 5 days, 6 days afterwards, I would say.
And I think that's probably standard because when we do a belt lipectomy, it's a 360-degree surgery. It's just probably that much more, 2 extra days of recovery, because we are going all the way around. And I know you and I talked a lot about that and whether or not going all the way around was the right thing. But I appreciate you being on board with that because it really helped me to sculpt your body. And when you looked at the pictures, and again, we're only at a week out, what was your feeling and your impression about the results so far?
You look in the mirror and you don't think it's your own body. I mean, it's that impressive, I think, of a change even after a week, even swollen and everything.
Yeah. And the other aspect that I have been doing for over 17 years is not using any drains. And I get asked to go all over the world to talk about this because people can't believe that we can do as much liposuction as we did in addition to the abdominal tightening and tissue removed with no drains. Was that an impact? Was that a factor for you as you were looking for a surgeon?
1,000%. I did not want to deal with the drains. I knew that, after reading kind of all the content that you had online and watching the videos that, it wasn't a risk, I think, as it's made out to be. And it was really important for me not to have to deal with that on top of recovery. Yeah.
And we are also very comprehensive about our prophylaxis for VTE, and VTE stands for venous thromboembolus, which is a blood clot that could happen in your leg and break off and go to your lungs. And it's very rare, but I have a very comprehensive program for this. And would you feel that has been relatively easy for you to participate in?
Yeah, absolutely. I have no issue with any of the process and procedures that you asked us to do, as far as the compression and the Lovenox, not an issue at all.
Yeah. My last question I always like to ask everybody, and I realize that you're only at 7 days, 8 days after surgery, but is this something that you would recommend to a friend?
Yeah, absolutely. I think if you want that self-confidence, you're not happy with yourself, why not do it? You only live once.
There you go. Well, you're wonderful in sharing your story, and I'm very grateful, as are all of those who dial in and listen to these podcasts to try and get a glimpse of how they may be experiencing the journey or getting answers to questions that may not be out there. So I really am grateful. Thank you.
You're quite welcome. Thank you.